The TGA has decided to ban Ivermectin.
Won the Nobel Prize in 2015 for use in human beings.
Just last Friday, September 10, The Guardian put out an article stating Australia's drug regulator has banned medical practitioners from prescribing the anti-parasitic drug Ivermectin for off-label uses, such as for treating COVID-19. Well, the whole of Sydney had to put up with that parasite Gladys this entire time, yapping and yapping in our ears. So technically, we've been infected by a parasitic-like creature. The article went on to say that the move comes after prescriptions for the drug increased between 3 and 4 times in Australia in recent months. The Therapeutic Goods Administration announced the ban on Friday afternoon, acting on advice from the Advisory Committee on Medicines and Scheduling. Hold on a minute, I gotta stop right there. I'm sick of no one going on scientific evidence or scientific data to make these decisions. It's always on advice. Hey, Kerry Chan.
Yes?
My advice is lock them down. Hey, Gladys.
Hey, XY, what up?
I've been advised to advise you to lock them down.
Good morning, everybody. In the 24 hours, last night, our advisors advised we lock down. Thank you.
The TGA detected a 10-fold increase in people seeking to import the drug from overseas in August, whilst pharmacists have reported a rise in people presenting prescriptions for the drug and refusing to say what it was being sought for. On Friday, the regulator said there had been a 3 to 4-fold increase in Ivermectin prescriptions in recent months. Well, that's funny because rooters, the rooters of our facts. The Centerline fact checkers put out an article stating that Sydney COVID-19's infections had eased. Well, I wonder what that could have been from. Now here is the caveat from this entire article.
Bloody what? There's more.
It is a quote at the end of the article from Dr. Karen.
Haha, Karen.
Ignore the recommendations from anti-vaxxers. Get yourself vaccinated against COVID-19 as soon as you can. Tell your friends and family to do the same. Now, I have a lot of issues with this article. However, this quote is the main one. Any discussions regarding preventative measures of hospitalization is getting automatically put in the anti-vaxxer category. So what I've done is I've gone directly to the source. They're saying that there is no other way out of this pandemic beyond these vaccines. Well, I asked the mRNA vaccine technology inventor, Dr. Robert Malone, his thoughts. Here's that discussion. Ivermectin's been around for over 40 years. It's been administered billions and billions and billions of times on humans. It's had multiple tests and data have proven it to work fine on humans. It's not just for animals. To my understanding, you also had a company that looked at repurposing drugs, and one of those drugs was Ivermectin. Am I right?
And I've administered it to myself under prescription from another physician for my long COVID. Something people need to recognize is that I was infected very early in the outbreak in late February of 2020, and I developed long COVID. When I talk about COVID and these other things, it's not theoretical for me. I've lived it.
Yeah.
And so is my wife. So I had clinical benefit from my long COVID. Many others that I know report clinical benefit with ivermectin.
Joe Rogan came out. He's come out and
Joe Rogan, your doppelganger here in the United States.
I can only hope to ever be even mentioned as the same sentence. So I do appreciate it. He is a great mentor, but please go on.
Yeah. So here's the 4-pronged strategy that I would advise your government. Not that they're going to call me up tomorrow, but it could be that other politicians in Australia might reach out to me.
They are nosy, the government over here. I tell you what.
Yeah, we'll have to make sure what we say so you don't get whacked.
Yeah, watch out. The government is wild.
So 4-pronged strategy. It's basically personalized medicine, a modern concept. Okay, so let's get out of the 20th century where I like to say you probably are too young to have kids. I've raised 2 boys. And I love the phrase, if you give a 3-year-old a hammer, everything becomes a nail. And this is true with RNA vaccines, it seems. And so they just want to bang every nail in with the same hammer. But it doesn't have to be that way.
Yes.
Okay. So what Peter Navarro and I advocate is, number 1, use the vaccines for the people that need it most, the people at highest risk. Number 2, make drugs available, allow physicians to practice medicine. Good God. Talk about common sense.
Yes. Yes, we're missing that somehow. We lost it somehow. We need it back.
Physicians, generally, not politicians, but physicians are the ones that have been through this stupid long training to learn how to treat patients. Why don't we let them treat patients, please?
Yes.
And there are many drug combinations and protocols using existing drugs that are dirt cheap. You don't have to use fancy new stuff from Pfizer and Merck. They're ivermectin, hydroxychloroquine, famotidine, celecoxib, fluvoxamine. The list goes on and on and on.
Yes.
And I'm sorry to say, I don't like the idea very much, but there's evidence now that certain anti-androgens work really good in the hospital. But they're temporary, thank heavens. Folks like yourself can appreciate what I'm saying.
Yes.
Vaccinate the ones that really need it, not everybody, because you're just driving the development of escape mutants by doing otherwise. And plus it's not ethical.
Yes.
You're hoarding all the goodies. Okay. Share. Don't be stupid. Number 2, early drug treatment, let physicians practice medicine. There are plenty of early treatment protocols. You want to get that treatment on board as soon as possible. Keep people out of the hospital. Okay. The goal here is not to fix them once they're on death's door, when all the damage is done. The goal is to keep them out of the hospital.
Yes.
So that means early treatment. Get it through your brain.
You heard the man. Get it through your brain. The episode with Dr. Robert Malone, the inventor of mRNA vaccine technology, will be out on Tuesday morning, followed by the video in the evening. If you enjoyed the video, please give it a like, share it out, and comment your thoughts. That's what I really want. I want to hear your thoughts on this specific topic. We're going to be doing more of this style content with a snippet of the podcast in there, since the podcast has now officially been deplatformed from this platform. You can only get it at worthprotecting.com.au. So we'll do this style content with some snippets of the podcast in there. Lastly, if you want to support the legal case, please donate. The link is in the description, and we're also creating a fund with our legal team to support other content creators across Australia. So please donate below and help content creators in this particular legal case that we're facing. Once again, hope you enjoyed. Be a mate, help your 5'8". Peace.